Start with one pump of softening lotion in your fingertips and begin massaging it into the chin area using gentle friction to help break down dirt, oil, and soften pores. Work your way up to the forehead, finishing at the temples, and repeat a second time. If your client has inflamed acne, use caution and minimize massage in those areas. Use 2 towels for a total of 2 minutes to continue softening the pores. Place the first warm towel and confirm the temperature with the client. Then apply a hotter towel straight from the warmer to lock in the heat. When wrapping the client, ensure the muslin cover the nose while keeping excess muslin away from neck and hair. Grab a tissue and place it by the client to wipe away the cavitation during the treatment. Fold a 4x4 into a 2x2, then fully submerge it in water, making sure it is fully saturated. Okay, time for extractions. Keep the softening lotion on. First, cover the client's eyes, then position the light to begin. Focus on the T-zone first and any areas of congestion. Communication during extractions is important. Inform the client what's ready to be extracted and check in on the pressure, asking if it feels right or if you should apply more or less. Apply water to the forehead with a damp 4x4. Use your free hand to lightly pull the skin on the hairline back toward you to keep the surface smooth and taut. With minimal pressure, glide the device downward across the forehead. Apply water to the nose using a damp 4x4. Stabilize the nose by placing your thumb on bridge and your index finger on the tip, avoiding downward pressure. Start at the bridge of the nose, holding the device at a 45-degree downward angle. Check in with your client. Could I apply more or less pressure? As you move toward the softer cartilage, gradually increase pressure for a deeper clean. Focus on gentle, controlled pressure rather than pressing downward. When working on the sides of the nose, tilt the client's head to the opposite side. Use your thumb to gently pull the skin while your index finger supports the tip of the nose, keeping the area taut. If you're left-handed, the technique will look slightly different. Anchor your thumb on the side of the nose while placing your index finger on the bridge of the nose. Demo with left hand, overlay here. The goal is to stretch the skin to keep it taut. Instruct the client to tuck their bottom lip inward. Use your thumb or middle finger to gently pull down on the chin bone, creating a firm, taut surface. Apply water to the chin using a damp 4x4. Glide the device downward on the chin with steady, controlled movements. Always make sure there is ample water on the skin at all times. Reminder to give your client a little break in between. Avoid using cavitation on active acne. Do not treat pustules or papules with the device. When treating the cheeks, gently hold the skin taut along the perimeter of the face and glide the device downward toward the jaw. Continue the extractions all the way to the other nostril, switching your index finger positioning as needed. When extracting comedones and sebaceous filaments on the cheeks, always create a stable base. Anchor with one index finger while gently pressing and gliding downward with the other. Use your thumbs to lift and stretch the skin for better visibility of comedones, and stabilize the area with your other fingers to maintain control during extraction. Using light pressure and a scooping motion, glide downward and inward to encourage the pus to surface. Imagine forming a volcano. Anchor one finger while applying gentle pressure with the other in the direction of the pore, adjusting your hand position as needed to ensure complete removal. Position your index fingers so they face each other and apply gentle inward pressure toward the center of the pore. For extracting on the chin, keep your index fingers facing each other with gentle inward pressure toward the center of the pore, while asking the client to curl their lower lip inward to stretch. Start at the chin and work your way up toward the forehead, then back down to the chin. Repeat on the other side, then move to the nose and spot treat as needed. If there's any blood present on a pustule, save that area for last to avoid spreading bacteria.